if the Senate bill became law, how would it change the healthcare industry?
Well, David, first of all, I would maybe pull it up just a little bit. And, our thinking is that it's representative of this major challenge that we have of how do we provide high quality health care in a sustainable way. And, we've been talking about this for a number of years, and whether it was with the Affordable Care Act, or actually prior to the Affordable Care Act, or what we're seeing now, it's this challenge of demographics here in the United States, of costs, and you see it around the world. And so, look, I still think that we've got a lot of slicing and dicing to do. And it's our hope that we find some kind of bipartisan approach. And I would also say that likely for the next 10 or 20 years, this is something that we're going to have to be working on because it's so important.
Well, you said the critical word, sustainable. If you look at Obamacare, you look at the House version of the bill, you look at the Senate version of the bill, do any of those realistically promise that we will bend the cost curve? Because we now have, what, 17% of GDP, something like that, on healthcare. It can't keep growing.
Right, it's really critical. And look, and by the way, we're just entering the critical phase when you look at demographics, the number of people who are 65 and older. So even if you hold some of the pricing, the sheer increase in demand based upon a population going from 12 to about 25% of our population over the age of 65, and when you turn 65, you consume about 5 to 7 times the amount of health care that you do before. So you're right. I think it's about how do we get that right balanced and making sure that we're effective, that we're efficient. It's 20% of our economy. But at the same time, how do we make sure we continue to reward innovation? How do we make sure that we don't compromise quality of care for so many of these patients who are depending on it?
What happens if those people either can't afford supplemental insurance, or they get kicked off of, say, Medicaid or something, or Medicare becomes a little less generous? Then that does affect you, right?
Absolutely, and that's why it's important to get this part of the bill right. And look, it's our hope that by working across a number of the different parameters that they're working on right now, what about the subsidies? What about tax credits? What about the different qualifications? How do you provide perhaps a little bit more flexibility at the state level? When you're talking about, the amount of dollars that we are, when you're talking about 20%, then we know that there are areas that we can do a better job, and it's going to be critical to focus on those areas.